Next, we will move to Mr. Doherty. You have the floor for 5 minutes.
Thank you, Mr. Chair. I'm going to move away from the hot topic of safe supply and would like to ask our colleagues or the witnesses this. We, as a country, we seem, I guess, weak and not able to stop these harmful drugs from flowing across our borders, whether it's fentanyl, carfentanil, and the precursors to these. So to the witnesses that are on there, I'm wondering if they've all got an idea or a suggestion. Mr. Felicella, you've been on the street. You've said that you've dealt in that. So I'm interested to hear your side on how we can, as a nation, stop these harmful drugs from flowing across our borders or into our country.
Yeah, that's the million-dollar question. I mean, honestly, it's just been an absolute debacle because you just can't stop drugs from getting into the country, unfortunately. I guess, the thing that you can consistently look at is they try to reduce it. But I've seen more drugs in prison than I've seen on the street in some circumstances. So the reality is that you're not going to, unfortunately, stop the flow of drugs from getting into the country or the precursors. And usually what happens is that it takes so long. You may get the low-level street dealers, but you don't get the big guns. We never get them. I mean, these people they're not even in British Columbia. They're in countries like Fiji and Vietnam and running an operation globally. I mean, this global war on drugs has really just provided an avenue for drugs to go everywhere. And these people are effective and efficient and understand what needs to be done, and they understand that there's also no shortage of people in the world that use those substances. So unfortunately,
sorry to cut you off. In your view, should Canada ban those precursor drugs?
Well, I mean, I don't know which drugs they are. They probably already are banned, but they still get in. I mean, drugs are banned in the country of Canada. Like, you're not allowed to, have fentanyl or produce it or sell it, but it still comes in the country. So,
thank you for that, Dr. Goulau. Our provincial health director of health, Dr. Bonnie Henry, testified at our committee last week that she's in favor of legalizing deadly drugs like cocaine, heroin, meth, and fentanyl. Do you support that?
I quote Mr. Felicella. It's $1 million question. I'm not sure. I believe that everybody wants to lower the impact of the use of substances in our societies. I'm not sure which is the best way to do it, to deal with them. In a regulated market, probably it's easier to track them, to follow, to have good quality products circulating. But will people tend to use more? Will deaths grow? Not sure about the consequences with this type of substances. Even with cannabis, it's not completely clear what is the impact of legalization / regulation of the market. So, not sure.
In 2023, overdose rates in Portugal were reported to have hit a 12-year high. What was the nature of that? Why is that?
In 2023, we had 74 overdoses deaths. Most of them are related to opiates, namely to heroin, and also related to crack cocaine. That's the main causes of it. I don't.
Thank you very much, Mr. Doherty.